Hello, it's Dr. Stewart here for Dr. Stewart's in the Know. First of all, let me apologize for not having a new video posted this past Thursday. We've had some changes at Meadows Medical Center. Our videographer and person who multitasks for us, well, she had her first baby, so congratulations. We're so excited. We have a new addition to the Meadows Medical Center family. With that being said, as you can see, the video that you're looking at is not quite polished like what she videotaped. So bear with me. We'll kind of soldier through it until we can get her back, okay? Or until I can find out how to do better videos. Now, I actually did a video for last Thursday, and I tried to edit it, and I tried to upload it, and I just had one issue after the next. So, with that being said, I just wanted to offer that apology, say we'll kind of soldier through, and hopefully you'll continue to come back here and get some good information to stay in the know. So I did, on behalf and in honor of our new edition, I want to talk about newborn care. So for all you new moms and dads out there, be it your first time or this is number 2, number 3, etc. Congratulations. So the newborn period is always an exciting time, but then a trying time. It can be very exhausting, and hormones are still flowing high, and so there's a lot to it. First of all, breathe, enjoy this time as much as possible, and just love on your baby. As far as some basic, you should already have been told this, but in case you haven't, sudden infant death syndrome prevention, your baby should sleep on his or her back in his or her own crib or bassinet. No stuffed animals, no extra blankets, and that's just for the baby's protection. Also, if you're breastfeeding, normally you should be breastfeeding your baby every 2 to 3 hours. Cluster feeding, where they're wanting to get on the breast every hour or so, that is normal. So typically for a newborn baby, they'll breastfeed 10 to 12 times a day. For formula-fed babies, you guys get a little reprieve, where usually the feeds will be from every 3 to 4 hours. Now, we don't want the babies to be sleeping long periods of time, even at night, because they don't have enough adipose tissue, so they can't fast for long periods. So don't give them cereal in the bottle or whatever other remedies there may be to make your baby sleep longer. The babies are supposed to wake up frequently to feed, and then they're sleeping and they're growing and they're pooping and they're peeing. So during that first week or so, they'll have weight loss, and that's why we want to check their weights, make sure they're eating properly, that mom's breast milk is in, and typically by 2 weeks of age, we expect them to be back at least to their birth weight. Remember that their stomachs are they're really small, like the size of a cherry. So they're not supposed to eat a lot. And again, that's why they're supposed to be eating frequently. So if you're like, oh, my baby is 2 weeks old and is guzzling 4-ounce bottles, that is too much. And oftentimes we get overfeeding and therefore increased spit up. And so just back it off. And let's not stretch the stomach beyond what it's supposed to be stretched. So that's that. So let's see. We talked about fees, pooping and peeing, lots of pee diapers, usually 6 to 7 wet diapers by 1 week of age, and poopy diapers. A lot of times if you're breastfed, the baby's pooping it just as much as they're peeing. So initially you get that green, dark, black, tarry, meconium stool, and then it will transition to like a yellow, seedy stool, soft, mushy, even quite liquidy, and that is normal. Formula-fed babies do tend to stool less frequently than breastfed babies, and that's a-okay. The main thing that you're looking for with stools is the consistency of it. Is it soft? Now, all babies will have some degree of gas, okay? So they're burping them is helpful. Massaging their bellies, doing the bicycle of the legs kind of helps let the flatulence come out. But do know that all babies that have some degree of gassiness, flatulence. Now, moms who are breastfeeding, your diet does make a big difference. So talk to your lactation specialist, your lactation consultant about what foods kind of are better at eating than others as far as gas production for your baby. So fees, stools, urinating, so our elimination, we got that. SIDS prevention, we talked about that. How about car seat safety? Car seat should be rear facing in the back, okay? So that is at least till they're 2 years of age, and really we recommend you keeping them in that position even longer if, as far as their size permits that. So car seat safety is important. Sleep safety is important. What if my baby gets sick, has a little cough, a little runny nose, congestion? Definitely call your child's physician. If your baby feels like he or she is warm, check their temperature. Underneath the arm is fine, or rectally. True fever is 100.4 or higher, but I always encourage my parents, if you see 100 or or higher, give me a call. Let's talk this through, because we want to be that much more careful when it comes to fevers and illnesses in the newborn period. So that's just a little bit of information. There's so much more that you as parents have to kind of know and remember, like vitamin D supplementation, and how to navigate having family over, friends over, but not too many family and friends at a time, avoiding overstimulation by trying to have infection control prevention. So, but hang in there. Give yourself a break. Enjoy this moment. Yes, you're supposed to be sleep deprived. Try to sleep when the baby sleeps. Okay, the dishes aren't done like they normally are done, or the floors aren't being vacuumed like they normally get vacuumed, but this time, even though it's tiring, it does go by quite quickly. So hang in there. All right, until later on this week, I'll see you. Thanks for coming back. Like us, subscribe us, tell your friends about us, and thanks for hanging in with us. Dr. Stewart's in the know. See ya.